From the moment our bodies sustain an injury, the intricate process of wound healing begins. This is not a single event, but rather a four-step ballet of biology, beginning with hemostasis. The goal of hemostasis is to stop the bleeding. Damaged endothelial cells release endothelin and other factors, which narrows the blood vessels through vasoconstriction to temporarily reduce blood flow. The release of histamine causes vasodilation, and platelets rush to the wound site to create a protective plug, combining with fibrin to form a temporary extracellular matrix. Next up is inflammation, which can present clinically as redness, swelling, heat, and often pain. This stage is all about defense. Early-stage inflammation is initiated by the influx of neutrophils, which arrive within minutes of injury and non-selectively destroy foreign bodies by releasing toxic granules. Monocytes are recruited and differentiate into macrophages. During late-stage inflammation, pro-inflammatory macrophages are responsible for phagocytosing pathogens and releasing inflammatory markers. Meanwhile, anti-inflammatory macrophages remove neutrophils by efferocytosis and release growth factors in preparation for the next stage. The proliferation stage is where the rebuilding begins. Clinically, granulation and epithelial tissue are apparent. Keratinocytes begin to multiply and migrate in response to different growth factors to form new skin. At the same time, endothelial cells respond to chemokines and growth factors to promote angiogenesis, the creation of new blood vessels. Simultaneously, fibroblasts proliferate and migrate, responding to growth factors and preparing for the final stage. The last stage is wound maturation and vascular remodeling. Here, the tensile strength of the wound starts to increase as collagen within the extracellular matrix is remodeled from type 3 to the stronger, more stable type 1 collagen. The newly formed fragile blood vessels are replaced by more mature vessels. And there you have it, the complex process of wound healing, a well-choreographed dance between many cell types and chemokines.